So tonight's class is all about maximizing gut health, and it's an area that I'm really passionate about because, as you probably know, your gut health is linked with so many other parts of your body. Everything is connected, and we look at the body in a very holistic way. We really want to get to the root of gut issues. We're going to talk about all the connections of how stress affects the gut, how what you eat, how you think, all of these things come together and really influencing what's happening with your digestive health. And so, as I'm going through this, if you think of questions, I will try to be aware of checking the question and answer box, but I'll probably by the end of the class, I will save space and time so that if you have questions, get them in there, get them into that Q&A box, and we'll make sure that we go through all of that by the end of the class. So I just don't want you to forget if there was something important that you wanted to ask. So as I go through this information today, please know that I am not trying to diagnose or cure or treat a disease process. Really what the purpose of this class is to create a foundation for maximizing health, for maximizing your healing. And when the gut is working well, it is amazing how other things feel within your body, how your energy shifts, how your clarity of your thinking, even your sleep, all of these things are affected. And we're going to talk about all that today. But that's my goal today with this class, is to really give you tools that can create a foundation for really improving your health, for maximizing your health, really get things moving in the right direction. So I wanted to start out with this beautiful picture of what a healthy gut looks like. And there's some really key things that we need to talk about today. So when you're looking at a healthy gut, this is like the lining of the small intestine. We want to have a population of good gut bacteria. It's really key that there's healthy gut bacteria and that there's a lot of healthy gut bacteria. Other signs of a healthy gut would be that there's a lot of prebiotic foods that are feeding that good bacteria that's part of someone's diet. So that's another piece that can really be a part of the puzzle of a healthy gut. We want to make sure when you see all these like finger-like kind of projections in the inside of the small intestine, those are called villi. And it's really key when you look at this picture. This graphic is really well done because what it shows in that villi is that they're standing up. And when they're standing up and they're not flattened or they're not basically destroyed, which we'll look at a different picture of what that looks like, but the body is in a state where it can absorb nutrients in a really effective way. But in order to do that, again, the villi have to be in this type of shape, and we want a lot of villi within the gut because that's going to, again, really ensure that the body is breaking down nutrients, and there's other steps that are part of that, but being able to absorb the nutrients that are broken down so that they can be used for healing and repair and energy within the body. We want digestion to be fairly uneventful, meaning it shouldn't be really symptomatic. If you watch TV and you hear lots of ads about about medications, you kind of get used to this mind frame that it's normal to have heartburn or it's normal to have indigestion, but it really isn't. We should have a fairly uneventful digestive tract, meaning you eat and your body eliminates, and you eat and your body eliminates, or you eat a meal and your body can digest that efficiently and it still has great energy and you don't go through brain fog. Your body can, be able to function for the rest of the day. It should be a fairly uneventful process. And we want a healthy peristaltic reflux. My parents first brought me to a chiropractor when I was maybe 16, 15, 17, maybe even 15, somewhere in there. And one of the things that she talked about was you should eat and then go to the bathroom, and then you should eat and eliminate. That is how your body is meant to work. And I wasn't familiar with that because my body didn't work that way at that time. But that is a normal peristaltic reflex. So your body depends on that process to be able to get rid of waste, for it to be able to detox appropriately, for it to, again, get the nutrients that it needs. But that's the process that should be happening in a healthy digestive tract. So what does that look like if it's unhealthy? So when it's unhealthy, when you look at this picture, the picture that you're seeing, like the pinkish kind of colored intestinal tract, that's the healthy side. So they're comparing it side by side of what this looks like versus the other side, which is an unhealthy gut. What you see, and then that's kind of like the beigeish colored gut with more microbes living in it. What they're trying to represent in that is that in the unhealthy side, there's maybe an overgrowth of unhealthy bacteria. So when that happens and we start to decrease the amount of good bacteria compared to bad bacteria, that's when a lot of symptoms will start to happen. The people often have terrible sugar cravings. There might be really low energy, brain fog, sleep issues, mood issues, but that is more on your unhealthy gut side. There can be yeast overgrowth. That's a really common issue with a poor functioning gut. And so yeast overgrowth can look like candida overgrowth, which is a specific type of yeast, but that type of overgrowth can really cause a lot of symptoms, but it is, again, an indicator that we need to work through some gut healing. In an unhealthy digestive tract, there can be low digestive enzyme production, meaning often because of stress and maybe like eating on the run and eating in stress situations and eating late at night or whatever the situation may be. But because of that, there's been a decrease in the amount of healthy digestive enzymes that are produced. And enzymes are what break down your food so that the nutrients can be absorbed. So all kinds of symptoms can exist with that. Often will mimic like a heartburn type of like a symptom or indigestion and what it looks like for the patient. But typically there's, not typically, but often there will be low digestive enzyme production for that patient. So the other really big key that I want to familiarize you with is that there can be gaps in the junctions between the cells of the small intestine. So when you look at the pinkish gut, you're seeing what they're representing there is that the cells, I'm going to use my hands here, are very tightly spaced. There's very little of what's called a gap junction in between those cells. Everything is very tightly put together in the small intestinal tract. And that's what we want. So that means that when the food is going through the small intestine, that food is being absorbed appropriately. In the situation in the unhealthy gut, what you're seeing are holes or spaces in between the cells. So there's gaps in the junctions between the cells of the small intestine. What happens in that situation is bacteria and toxins and undigested proteins and fats can then enter the bloodstream. And why that's so significant is that your immune system does not want fats and undigested proteins or bacteria and toxins within your bloodstream. So that situation of what's called a leaky gut then causes our immune system to go into overdrive. And if your immune system is in overdrive, trying to attack all of these other like bacteria and toxins of undigested food that is happening, that is moving into the bloodstream, it's weakening your body's ability to fight other types of infections that you may be exposed to. So how that person may present is they're always getting colds or they're always getting flus. And if you look at the body holistically, you kind of have a clue that at that point that between what's happening in the stress response as well as the immune system and the gut, that is not functioning well together. But leaky gut in that situation, so we'll describe it a little bit more what that looks like in a chronic situation, is becoming more and more common. What they're showing is that it is very possible that 80 to 90% of Americans have leaky gut. Research has shown that it's at least 50% of people have leaky gut. So 50% of people out there have this situation of an unhealthy gut happening. And again, that can present in many ways. So I'm going to tell you a little bit more about what that can look like. But if we're really going to get to the root of the issue, there's different things that have to be addressed in order for that to heal. And I will tell you, as someone who's worked on healing leaky gut for my own health, it is not a quick process, but it is one that is totally worth the journey because your whole body will thank you for it. So if leaky gut, I hope that makes sense in what I'm talking about, but leaky gut is a big issue for a lot of people. But we really don't want the immune system so busy attacking all of this stuff that's literally penetrating the gut wall and moving into our bloodstream. We want our immune system focused on, keeping us healthy in many other ways. So this can lead to, so I just want to I'm going to briefly go over this and we're going to talk about more of what you do about this issue, but it can lead to what are called IgG food reactions. So we need to discuss the difference between an IgG food reaction versus an IgE food reaction. So let's just use peanuts as an example, because peanuts are well known to produce IgE, like an elephant, IgE food reactions. So an IgE reaction is a very immediate reaction. It's the type of immune system response that will produce. So literally you have like immune system cells, immunoglobulins that are then attacking like an antigen or some kind of a protein, say the peanut protein, and producing like hives and swelling and difficulty breathing. Very, very quick response. But that is literally the process. If you look over on this chart, is the immune system is identifying something as a threat, and it increases the mast cell or activates the mast cells. And in that situation, again, it can be this like flushing, this big response within the body. The difference for that, if we're talking about an IgG reaction, is that IgG is slow. So IgG may take a couple hours to produce an immune system response. So again, say you've got leaky gut and you've got food particles going through the small intestinal wall into the bloodstream, and the immune system notices that, identifies this as a threat, but it's a slower response. So it may take a couple hours to really notice the effects of that. So that can be kind of a difficult one because people don't know, they don't know what to attribute the way they're feeling to when they ate or what they ate that really created the issue. And when people have a lot of IgG reactions, so I'm just going to use wheat as an example. So maybe they're having an IgG reaction to wheat. A couple hours after eating that wheat, or maybe it was like a sandwich bread or something, they may feel bloated, just feel uncomfortable. And the next morning they may wake up and they feel like their skin feels tender to the touch, or they just feel like really lethargic, or they have brain fog. So again, kind of diffuse symptoms. And that may kind of go on and start to diminish after about day 3. So they can have like an extended response. But it takes about 3 weeks to fully clear out that inflammatory process. And in that, if there's leaky gut happening, so the immune system, these IgG immunoglobulins are attacking the antigen or the allergen, and they're creating what's called an immunoglobulin complex. So I'm just like, there's this big complex of immune system cells and the protein that your body reacted to that is now being deposited into maybe the joints or different organs. And the reason that that's so important is because it can show up then as a food is actually, and the way that the digestive system is being affected is actually then affecting the health of other organ systems of the body. And so that can eventually, for some people, and especially if they're genetically, exposed or pre-genetically disposed to this kind of a condition, that can end up as an autoimmune condition. So there's a lot of complexity of what's involved with this, but the issue is there's 2 kind of main things that we're going to go back to is how do we improve the health of the gut so we can increase the integrity of the intestinal lining, but how else do we improve the stress response? Because stress is the other driver of this situation. So I hope that makes sense. So an IgG food reaction, and think of that, like if someone say is had a wheat sandwich and maybe it's something they don't eat very often, but then they have it a couple days later, or maybe a couple days later, or a week later, that inflammatory process is continuing to build within the body. And the person may have no idea what's creating it, except that when we do testing or figure things out, it's actually the wheat that their body is creating this IgG response to. So I would just want to go through this very quickly, but this is what the research has shown is that long-term IgG antibody reactions can lead to IBS, irritable bowel syndrome, which I was like, let's get to the root of IBS instead of people just thinking that they, have symptoms that are just difficult to deal with. Well, let's figure out what's actually creating that. It can lead to autoimmune issues, which we just discussed, headaches, migraines. It can be linked with ASD, autism spectrum disorder, and ADHD. That's obviously a lot more complex, but it can be one component of the situation. Chronic ear infections, chronic sinus issues, allergies, insomnia. So there's many things that if you've got this process going on within the body, it creates a lot of other issues that can be present. And the way I will describe that, how I typically see that and present is that, so not only is this gut issue going on, but when all of this toxicity is building up within the gut, the liver has to process that. And so when the liver has to process something, it can burden the toxic load within our body. So when we talk about like stressors being chemical, emotional, physical, sometimes it's literally just the amount of toxic burden that someone's body is processing, even though in their mind, they're eating the right foods, they're exercising, they're drinking a lot of water. But sometimes people need to be able to clear something from their diet, or they need the right support in order to be able to move that toxicity. So it's like that makes sense. Their body is toxic, even though they're not being exposed to like major chemicals or anything like that. It's just the reaction that's happening within their body that's making them more toxic. So what causes all this? So we've done tons of research on this over the years. It's something I've taken many, many seminars on. The number one cause of this is shown to be stress. And I'm going to explain the physiology of that in a minute. But there can be like a lot of the processed foods, a lot of foods that we are exposed to in America. Because if you look at like a package label of a processed food, you're typically going to see a lot of different chemical additives that have been used to make it taste good or make it have a certain texture. But a lot of that kind of food has been shown to stimulate the overgrowth of the bad bacteria, the harmful bacteria that can be within the gut. It can increase sugar. It's usually really processed, often with sugar, which it can cause, again, bad bacteria overgrowth. It can cause yeast overgrowth, and it can cause the body to be in a more acidic state. So again, when we talk about toxicity, always remember that toxicity creates acidity within the body. We want to move towards a more alkaline state would be the goal, to be able to clear or reduce acidity or reduce the toxic load in someone's body. Pesticides and insecticides have been shown to cause leaky gut. Antibiotics are a big cause of leaky gut. Long-term toxic mold exposure. Infections like Epstein-Barr or Lyme disease can cause leaky gut, and all of these gut issues. Alcohol, maybe not the occasional drink, but if someone's drinking larger amounts of alcohol, that can make a difference. NSAID pain relievers are a big culprit of having these types of gut issues. Food sensitivities, and maybe what I mean by that is that obviously leaky gut creates food sensitivities for the body. So if someone has continuing to if leaky gut is undealt with and these food particles are escaping into the bloodstream and the immune system keeps reacting to them, that can create food sensitivities. But the other way around, if someone is dealing with a food sensitivity, maybe knowingly, and continues to eat it, it will continue to create more like a more severe case of leaky gut and more imbalances in bacteria and yeast, all of it. And radiation and chemotherapy are known to cause leaky gut. So it gives you some examples. I want to explain some of them are pretty straightforward, and I'm going to give you some more information as we go through the class about things that you can do to find out more about if these things are affecting you. But the big one that we want to hit on is, why does stress create this? So we'll get to that in a second. What leaky gut and gut issues can lead to in general. So if the gut just isn't functioning well, when people come in and they have eczema and skin issues, I look to the gut. When people have long-term anxiety and depression, we at least want to rule out gut issues, or at least work to have a protocol in place to rebuild gut health. Brain fog and concentration issues, obviously gut symptoms. So things like constipation and diarrhea and bloating and heartburn and IBS. Sleep issues, allergy and sinus issues are very commonly gut issues. People will talk to me about, mucus that just hangs out constantly in their throat. I'm thinking gut in that situation as well. There's something that the immune system is overreacting to, something that the body is not dealing with effectively, that's affecting the amount of mucus that their body is producing. Just having a weakened immune system in general, we're going to look at the stress response, we're going to look at the nervous system, we're going to look at gut health. Someone who's easily dehydrated. So this is a really important one to look at. So different clients I've worked with over the years have come in and just said, I just did like a simple workout, or I just sweated a little bit more, and then I had terrible diarrhea and leg cramps. Maybe they didn't even have leg cramps, but they had like diarrhea that happened. I'm going to typically think that person maybe are not clinically dehydrated, like they don't need to go to a hospital, but they maybe need to really work on their hydration levels. And so when you think again of that leaky gut kind of a situation, not only does the leaky, well, what happens is that that leaky gut has trouble moderating the amount of liquid that the body can hold. And it's very easy for someone with leaky gut to become dehydrated. So we'll often use like electrolytes and really kind of boost up how the body is able to hold the appropriate water levels and hydration levels. And that can make a huge difference, but then it also is a huge difference in terms of how the gut functions. So toxicity, weight issues can also be very related to the gut. So again, leaky gut can make the body very acidic, very toxic. It's very difficult to lose fat when the body is toxic. So again, it's kind of the underlying physiology of what's going on really needs to be addressed. Then we have osteoarthritis. So when we think about those, we talked about in leaky gut how the bacteria and food particles are getting through the small intestinal wall. The immune system is attacking that. It can create immunoglobulins. Those kind of complex, or the immunoglobulins in the food, are kind of joining together to form this immune complex that can be deposited into joints. So osteoarthritis typically develops when there's been a joint that's been misaligned for a long time period, and the person continues to walk and move and do the things that they do throughout their life. And that if that misalignment is not addressed, it creates a wear and tear within the body. The body tries to stabilize it by putting extra bone into that, but that's not a good long-term strategy, because now you're starting to create immobility, decreased mobility in general, but also pain. But it's the gut piece of that and what's happening with those immunocomplexes and where they're put into the body that can really aggravate that arthritis and create more inflammation if those are deposited within the joints. And then we have autoimmune disease, which we talked about, and I'm going to hit on that in just a second here. So the other piece of that then is why stress plays so much into this. So you've probably heard of the enteric nervous system. So in chiropractic, we work on the central nervous system. So we work on the brain, spinal cord, and that connection. The enteric nervous system, though, is the part of the nervous system that there's like 100 million cells that actually that are in the lining of the gut. And so when you experience stress in your nervous system, meaning your spinal cord and your brain are processing that and creating maybe a fight or flight response, or there's been an irritation within the gut, so maybe a food that didn't go well, or there's an infection within the gut, or there's something else going on, it goes both ways. But that enteric nervous system is highly connected to what's happening within the CNS, the spinal cord and nerves and the brain. And so when that happens, especially when stress becomes chronic, or this gut is being affected over and over and over again, so again, goes both ways, that is creating a situation where the hormones of the body, so think like cortisol, think, how do we say that? So we would think like cortisol and adrenaline are really affecting what's happening within the body. That physiological state becomes kind of the norm, where all of that kind of a situation with what's happening with the stress in the body. Then again, when we go into chronic stress, we have increased adrenaline, we have increased cortisol. The cortisol is what hangs around. The adrenaline kind of dissipates, but the cortisol is what sticks in there, is creating this new hormonal kind of state within the body. That state of chronic stress then alters the gut bacteria. And so when you alter the gut bacteria, now you've created a situation of dysbiosis, meaning we have altered levels of good bacteria compared to bad bacteria, typically an overgrowth of bad bacteria. That then creates a state of chronic gut inflammation. That chronic gut inflammation is very much contributing then to the situation of leaky gut, where we have the gaps between the tight junctions of the cells. In that situation, then we end up just like what we talked about, food particles, bacteria, toxicity going into the bloodstream, making the entire body toxic, inflammatory complexes being deposited in joints. Genetics will obviously play into this, but that can be like leading to autoimmune conditions like rheumatoid arthritis, lupus, Sjogren's disease, hypothyroidism. There's all kinds of things that can be then correlated with that. So that's really, when you think of chronic stress, the enteric nervous system, if you think of simple things like I feel butterflies in my stomach when I'm nervous, or when I'm anxious about something, I have to go to the bathroom. That is the correlation between what's happening between the enteric nervous system and the central nervous system. But those pieces of the nervous system are communicating constantly. And so whenever you feel stressed, it's affecting your gut. Whenever your gut is experiencing stress, it's affecting your brain. So those kind of connections have become very, very clear within the research. We know that that is really why people notice such a difference in terms of their body, their quality of life when there is a gut issue happening. And again, based on some genetic issues as well, that can lead to autoimmune issues, or if the body isn't able to detox as well as it should, that can lead to some autoimmune issues as well. This is the other piece of it. So when you think of like in chiropractic, again, we look for misalignments or what's called a subluxation of the spine. When you have that and you look at the subluxated model, you're seeing that the spinal cord has the spinal nerves that communicate with all of the different organ systems within the body. And if there is a high amount of stress, or if there's a high amount of fight or flight, or maybe there's been injury to specifically the areas of the spine, like around T4 to L2, so kind of the mid to kind of the mid upper back down into the upper lower back. When all of those nerves specifically affect parts of the digestive system. So if there's been injury to those areas or different stressors have been stored in those areas and they're putting pressure on those nerves, that's decreasing the amount of information that the brain is using to regulate between the CNS or the central nervous system and the enteric nervous system. So that's another thing that we're always looking at, because if you don't address this part of it, it's very difficult for nutritional changes to work effectively. It's very difficult for supplements to work effectively. You need to look at the whole picture, and you really need to figure out how we're going to get the gut to really heal and how we're going to get the stress response to truly shift. And that plays right into nervous system dysregulation. So when most people think, now, this is like, again, going into the CNS and the autonomic nervous system part of the CNS. So we look at this, the autonomic nervous system has the sympathetic side and the parasympathetic side. So in the sympathetic side, this is where most people are, most Americans, you look at their stress level, this is where they live most of the time. Their body is in fight, flight, or freeze. What that looks like when you're in that state is it increases your heart rate and your respiratory rate and your blood pressure and your pupil dilation. It increases the blood flow to your muscles. You are literally ready to fight or flight at any time. And so in that process, though, this is the big piece of it, is that when all of that activity is going on, it decreases the function of the reproductive system, the immune system, and digestion. And so literally when people are in this dysregulated state, we need to get that stress out of the system in order for them to be able to move into parasympathetic, where their digestion can actually function well. And I'm going to give you tips and tools that you can use, because when you start to apply these things on a regular basis and they become your lifestyle, you can see changes in your digestion just by how you're regulating your stress. And there's a lot of things that I need you to do. There's a lot I can do, but there's a lot you need to do as well that can make a difference in terms of how you handle that on a regular basis. But we want to move towards people having more parasympathetic activity, because that's where the healing, the rest, digest, that's where all of that takes place. So the plan then, if we're looking at really healing how the gut is functioning, is we want to heal chronic stress physiology and realize that that is a process. Most people that come to see us have been in chronic stress physiology for most of their lives. And that's just our society. That's life. It's the demands we have. It's what is put in front of us on a daily basis, what we expect of ourselves to be able to accomplish. So we need to have strategies for that. But then realize that when you take consistent action with that and it becomes habit, you're going to see gradual healing changes, and you really truly are getting to the root of the problem. And then we have step 2, which is actively work towards gut healing strategies. So I'm going to give you all kinds of nutritional ideas that you can do, that you can apply, that the longer and the more efficiently your body is in a parasympathetic state, you're going to see changes more, that the subluxations are being addressed. So we're actually getting the nervous system to function well again, get proper information from the brain to the rest of the body. And you start to add in these nutritional changes that can be life-changing. So we want to talk about how you're going to heal the nervous system. So these are really key things that I need you to start to develop as a practice, not just something that you do like occasionally. And so when I say as a practice, I want you to use whatever you need to remember that these are things that you need to do throughout your day on a consistent basis. So what I mean by that is like you could use alarms on your watch. You could use alarms on your phone. You could use Post-its. You could put these things into your planner as like, hey, this happens at 10 o'clock or 3 o'clock or whatever. But we want to think about things like using breath work to modulate what's happening within your nervous system is really key. And when people have high amounts of stress, because that really shuts down the function of their digestive tract, we want to make sure that they're having strategies to pull them out of that and use them, again, these strategies on a consistent basis. So in through the nose, out through the mouth breathing, it's what we have you do here on the adjustment table because it activates parasympathetic nervous system function. And so I would like you to do that before you eat, but I would also like you to take like a breathing break, maybe at, maybe the stressful time of your day is from when you start checking email or between 8:30 to 10 or whatever it is. So 10 o'clock, you purposely set an alarm that you are going to take 10 in through the nose, out through the mouth breaths. And you do the same thing at 4 o'clock p.m. or whatever you choose. And you do the same thing before you go to bed. You might notice an immediate difference when you do that, but I want you to start to do that as a practice because the more you do that, the more that response builds. For the kids that we work with, I always talk to them about it's like building your peace muscle. So we want you to be able to have this experience of like how you can, how to describe that, have practices that are helping you to be able to modulate what's happening in your nervous system. And that, again, the more you do it and the more consistently you do it, the more you will actually notice the difference. So other key tools to use are going to be things like mindfulness and meditation. So this, again, a physiological change happens when you do this. So if you have a daily meditation practice, I love Insight Timer. It's a free app. There's thousands and thousands of teachers or like throughout the world that have put their meditations onto that app. I have my favorites marked and bookmarked, but having a practice where maybe you do that first thing in the morning, maybe you do it before you go to bed, maybe you take a lunch break. I actually have my usually morning meditation and then right after lunch meditation. But the research shows that 12 minutes a day is what is needed to create more peace within the brain. And again, this response builds and it will affect the digestive tract over time because you're putting the body into a parasympathetic state. Using things like present time consciousness, it's what I use when I adjust every day. If I seem like I'm like very focused or I'm, kind of people are talking to me and it takes me a minute to go into that conversation, it's because I'm very focused on what I'm doing at that time. And what present time consciousness does, again, it calms the nervous system and activates the parasympathetic system. So when you use that, instead of becoming really stressed within your body, you can feel things kind of slow down. You might feel your breathing slow down. Instead of having all these thoughts pop into your head, you become very specifically focused on what you're working on at that time. And then using mindful eating, chewing, and drinking. And I'm going to talk more about that later, but I just mean slow down. So instead of eating while standing, eating within your car, eating on the run, you're purposely taking a minute to take some deep breaths before you start to eat. Put your body in a calmer state and then eat your food. So again, these are habits that we can build over time. And then there's nature and movement. Movement is key for the peristaltic reflex. So if constipation is an issue, you need to move your body. So that's really key. You need to stay really hydrated, but movement is key for helping your body function at its best in terms of the normal digestive tract reflexes. Exercise and just in general, because of how it helps the body detox, is really important. So like breaking a sweat every day can help your body, even if you're trying to heal from leaky gut. It doesn't have to be really intense exercise, maybe nor should it if you're dealing with leaky gut, but we want to make sure that you get movement and that you can get some type of a sweat so that we detox a tremendous amount through our skin. And then daily time in nature, if you can do that, I highly recommend it. I think that maybe if it's harder to do that than the other things, then maybe we focus on the other pieces. But all of these are mindfulness activities that put our body into parasympathetic, which is how our digestive system is going to function at its best. Okay, so the next thing that we want to focus on is I'll give you a very brief thing of what network spinal does. And I need to preface this by saying that so Dr. Scott and I practiced network spinal analysis for 20 years. Network spinal is now the newest version of network spinal analysis. So we've talked about this, that our training is always changing as more and more research comes into about what's happening within the nervous system. What we do, how we do it, the different elements that are incorporated is always advancing. And so you're going to see network spinal more and more because that is what is emerging. But network spinal chiropractic is one of the most researched ways of decreasing fight or flight within the nervous system. And so we want to create more resiliency. What I mean by that, one of the most common things I hear from our clients is that they are able to heal faster, recover faster with care. What that is the whole concept in research called resiliency. Meaning as your nervous system functions better and we start to heal the subluxations of the spine, we start to improve how the nervous system is functioning, how we're actually shifting how pathways are firing within the body. We're actually creating new pathways with network spinal, new pathways that allow the system to be able to function at a higher level. All that is happening with your adjustment process. But when that happens, you're actually going into a state where your body can heal and recover and actually handle the stressors that it's confronted with much more easily. So that's what when I talk about resiliency, I want you to be able to recover faster. I want your body to be able to move out of a stress state more quickly. I want your body to be able to reorganize so that we're getting better nervous system information coming from the brain to the organ systems of the body. All of that should be happening. But we also want to, in that process, be kind of really working on physical, emotional, mental trauma, which can happen when we create enough safety within the body. People are able to release a lot of trauma. And so that's really key as well in terms of clearing out a state in the body that doesn't allow for healing. So we want to really improve that state. So I hope that makes sense, but can be a key part of really healing the nervous system. So if we talked, we kind of went through like, okay, these strategies here are really key for how you're going to function, how you're going to improve your habits that make a really big difference in terms of your digestion. And what I didn't include in here, and I probably should have, is sleep. So I know that if I don't get a good night's sleep or if I don't sleep well, that my digestion is affected because again, your body then is drawing on more of a fight or flight state in order to kind of get through the day when you don't get enough sleep. So sleep is another component of it. And what's odd enough is that when the digestive system isn't functioning well and your body is toxic, sometimes that actually affects how you sleep. Just like we talked about IgG, food allergies can actually cause insomnia. So healing the gut can be a critical aspect of really improving how the deepness and the quality of the sleep you're able to get, the feeling restored after a good night's sleep. So just know that about that, but sleep is another piece of it. So network spinal is another piece that can really start to heal the nervous system. All of these things come together. And then we go into nutritional changes. So in IgG, we talked about the difference between IgG and IgE antibodies. But some people want to really go into that, like what is creating my food reaction? Or what is creating my digestive? If I have, which we can assume, just given the research, that most people have leaky gut at some level. Maybe the severity of it differs, but at some level, most people have leaky gut. They can do two different processes in order to determine what IgG allergies exist. So I'm going to give you the one that you can do on your own first. So say that you're thinking, I'm going to again use wheat because it can be a culprit for a lot of people, or you could choose dairy products, whatever. But you would take that food out completely out of your diet for 3 weeks. Meaning you look at every label that you eat, you meal plan so that you're not, going to be using that with your cooking or any of your recipes. You maybe are very careful with what you do when you eat out, but you make sure that you don't have a particle of wheat in your diet for a 3-week time period. And what you can do at that point is then reintroduce. After the 3 weeks, reintroduce that food and wait 3 days. And what happens? Do you feel bloated? Do you have a headache that comes on? Do you have poor sleep? Kind of think about that process. Hold on just a second. So you look at, you kind of waiting, like what happens when I eat that food? I've worked with so many clients over the years that will say, oh my gosh, I ate, I had the wheat and I got extremely bloated. I had the wheat and the next morning I had diarrhea. I had the wheat and I got a terrible headache. So when we have that kind of response, it's a way for us to be able to tell exactly what that food's been doing. Where if you keep eating that food all the time, you're going to have this low level or maybe high level of inflammation and not even know how that food is truly affecting you. But if you spend the 3 weeks without it at all, and then introduce it and you can watch your symptoms in those 3 days. Remember, we talked about an IgG reaction, that the majority of it is happening 3 days after exposure to the food. So when we have that wheat, so maybe you had wheat toast after the 3 weeks and you did not have wheat again for 3 days. I don't want it in your system again. I want 3 days to see what happens in your body. And did you have, again, poor sleep? Look at everything. And you're going to get an idea, most likely, of how that food is affecting you. And maybe it didn't affect you at all, but you decide to test another foods. And then maybe you go 3 weeks without dairy, have dairy once, wait 3 days, see what happens. But that will give you a lot of information. There are some people that I've worked with that don't want to do that, so we order blood work. And you can do an IgG test that tests, it's like 160, 170 foods. That looks at your IgG reaction and actually categorizes it to tell us, is it mild, is it moderate, is it severe, so that we can get that information that way as well. So there's different ways if that's something that if you need our help with, just let us know. But otherwise you can do it on your own, but it is a process. And then the other thing that I think is really key, if we're going to talk about like for the majority of people, if they maybe they do IgG work, maybe they don't, but consider an anti-inflammatory nutritional plan. What that looks like is eating lots of vegetables. So vegetables are kind of like key in that piece of it. For people with a lot of digestive issues, I would recommend roasted or steamed vegetables or sauteed cooked vegetables. Having clean sources of free-range animal protein, if that's what you choose. Like protein is really key actually for healing the gut and detoxification. But you want to make sure that you've got organic free range if you can do that. Plant proteins are great as well. Healthy sources of fat. So when we talk about anti-inflammatory fats, those are typically avocado oil, coconut oil, and olive oil. So just some things to think about. There's different ways you can do that, but your goal is to just really decrease the amount of processed food that you're consuming, which will give the digestive tract a break and allow things to go more into healing stage. Consider foods that are supportive of the digestive system. So drinking bone broth. So a couple times in the winter, I'll make big batches of bone broth. And I'll add in carrots and celery and onion, and we'll cook it all day. And then we'll scoop that bone broth out and then get rid of all the bones and freeze it so that it can be just like sipped on. But that is very healing to the gut. If you think about it, the body does not have to digest that at all. So when it is like the body doesn't have to work to get the nutrients. And so that's why that food can be so incredibly healing. And it is full of nutrients. Steamed vegetables. Eating gluten and grain free. And I talk about that. And it's some people that it drives people nuts that I talk about that. But it's been shown that for the majority of the people that gluten is inflammatory. And so that is something that can be looked at if you go gluten free. I just want you to be careful though, because if you choose gluten free processed foods, you're still going to end up with all kinds of additives and sugars. So that's not like the way to go. But just think about like using, if you sparingly have like a gluten free piece of toast, that could be better for you. And then maybe a piece of whole wheat toast. Dairy-free is also a consideration. I will tell you, especially with the people who have excess mucus production, a lot of sinus issues, maybe a weakened immune system in general. We work with a lot of kids. Usually going dairy-free can make a huge, significant difference in terms of the amount of mucus production that happens within their body. And so that is another thing to look at. But dairy-free or dairy can also be another really big culprit of IgG food allergies. Greek yogurt, I actually buy almond-based. It's like Kite Hill almond-based Greek yogurt. But I love that there's a higher protein content. I love that I can get a lot of good bacteria within that, but it's not even dairy. So it's an option, but there can be some really healing components of that. Foods like sauerkraut can work as like prebiotic foods, which we'll talk about in a minute. They feed the good bacteria of the gut. Cinnamon is another prebiotic. There's all kinds of prebiotic foods that you can find. Ground flaxseed can be a great source of good fat for the body that is also works as like a gentle fiber source, and chia seeds as well. The power of detox. So we talked about how leaky gut creates a toxic body. Can create systemic inflammation. It can increase the acidity within the body. It can cause weight gain. But for some people, if leaky gut is really severe, like like if a celiac would be like a very severe case of leaky gut, there's other issues happening there as well. But in that situation, they might have like trouble gaining weight because they're not absorbing enough nutrients. But for some people, it causes weight gain as well. Altered body composition, meaning it's just maybe it's really hard for someone to put on muscle. Often they'll have a more like acidic, more toxicity within their system. So when we recommend healthy detox programs, it is because we want to increase the alkalinity within the body. We want to naturally upregulate liver and kidney and digestive support so that the body can go into a state where it can clear inflammation. And it also just gives the gut a break. So the gut is able to clear inflammation. It's able to start the healing process of healing the lining of the digestive tract. So often we'll do like an IgG protocol or maybe do testing so someone can see what their IgG antibodies look like. And then they'll do a healthy detox for maybe 10 days, clear out all the IgG foods, and then work on healing inflammation, and then move towards just having a completely free diet in terms of they're not being exposed to those inflammatory foods that were affecting their system. Organic foods, wild caught, free range. The reason that we would recommend these is, there's probably other reasons as well, but because pesticides and insecticides, heavy metals, antibiotics all create alterations in the good bacteria of the gut. And so when we talk about the underlying physiology, the stress physiology, as well as this issue, that can be another one that can make a difference in terms of the overall toxic load in someone's body, and also then facilitate the gut healing process. Other things that I just put together, you'll see a little bit of contradicting information here. I've done a lot of talking today. Okay, so when we go into this, intermittent fasting can be one tool that people can use to really help their body give the digestive tract a break. So some people do really well with that. I am not one of those people. I don't do well when I fast, but some people do really well with that. And so it's something to definitely explore and see if it makes a difference for your digestive tract. Other people do really well with 3 meals a day and just being consistent with that. I want you to think about just, again, eating slowly, chew your water and drink your food. Again, the first chiropractor I ever worked with told me this, that she wanted me to chew my water, meaning swish my water around in my mouth, because all the nerve endings of my mouth would then prepare my body to be able to digest the water and utilize it well. Same thing with drinking your food. Chew it well enough that it's almost like a liquid, because again, it prepares the nerve endings. It's in the mouth, the nerve endings in the mouth are then preparing the digestive tract for being able to absorb the nutrients. Avoid overeating. I want you to slow down enough to be able to listen to your body's cues. Use the in through the nose, out through the mouth breathing before eating. Stop eating 2 hours before bedtime. We really want to increase the fiber intake for your digestive system to work well. And so the goal with that is that you're consuming 25 to 30 grams of fiber per day. So that's one that you could really look at and see how much fiber am I consuming now. Maybe it's 10 grams a day. You do not go to 25 grams overnight. You would slowly increase that fiber week by week to help your body adapt and adjust. Water is essential for the digestive tract. So you want to make sure you're increasing your water intake, and a minimum that you're having half of your body weight in ounces of water per day. Again, you can work on increasing that slowly. You can do that over a week time period, but I want you to make sure you're really hydrated, because your digestion really depends on that in order to work efficiently. And then we think about drinking water throughout the day, but stopping drinking water about 30 minutes before a meal and waiting 30 minutes after a meal before you start drinking. water again. And the reason that is that we don't want to drink water with meals because it dilutes the digestive enzymes that your body does make, that are being produced in order to break down your food and break down your nutrients so that they can be absorbed, especially not ice water because it literally freezes the digestive system. So you can do like other things like I put in a metal water bottle, I will typically put lemon essential oil in my water. That's okay for digestion. But if you can help that shift the pH of water, your body will actually be able to break down, like it will preserve the function of the digestive enzymes pretty well. So lemon in the water can work really well. We just don't want you drinking plain or ice water with meals. So I wanted to go into like other supports that you can do, so supplements that you can use. And I work with a lot of supplements. I've taken a lot of seminars over the years and different supplements and really trying to fine tune. I love the nutrients that are in the Research Nutritionals Renew Gut Plus. This has a combination of nutrients that is ideal for healing the small intestine. It fortifies the gut lining and the tight gap junctions, and it helps to rebuild that mucosal layer of the gut so that we can preserve healthy gut bacteria. I have used that one over the last couple of years. It's made huge differences in terms of the health of my gut. So that is one to definitely consider. A lot of people will hear about glutamine as something that restores the tight junctions or helps those tight junctions of the small intestinal lining heal. The thing that I see about glutamine is that, again, depending on someone's genetics, it can push someone into like a overstimulated state. And so they can feel like kind of jittery. They might feel like brain fog. So I like using other ingredients besides glutamine, but that's the Renew Gut Plus has been a really effective supplement for a lot of the patients that we've worked with. Again, it doesn't happen overnight. This is something where you keep giving the body the right nutrients, and over time we see more and more healing of the intestinal tract. Biocidin is a great product that removes harmful gut bacteria. So often someone will be on like a biocidin kind of a plan where we use that for like maybe 4 to 6 weeks to remove the harmful gut bacteria. And then we go into a major phase of adding like maybe about week 4 or so, or even week 3, we start to add in good probiotics again. So we're killing off the bad bacteria, but we're also replacing with good bacteria. Zymogen's candicidal. This has been one of the most effective supplements that we've used for improving the function of the immune system in terms of, I guess you're not improving the function, but you're clearing out quite a bit of yeast, bad bacteria, and calming inflammation within the gut that can make a significant difference for the immune system. So I love that supplement. We use probiotics, Metagenics Ultraflora Plus, Claire Therabiotic Complete. They have different types of good bacteria. So as you can imagine, if there's billions of good bacteria within the gut, we have many different strains. And so we like to shift that out so that people are getting exposed to different types of good bacteria, which can again improve the health of the gut, repopulate the good bacteria. And then prebiotics actually nourish that healthy bacteria. So a lot of times we'll use the product Thorn Fiberman to actually nourish the healthy gut bacteria, meaning we're actually feeding good nutrients to the bacteria of the gut to make a difference in terms of helping them grow that good, healthy gut bacteria and for the good gut bacteria to thrive. Then we use electrolytes. So I use Designs for Health Electrolyte Synergy. It is incredible in how that can protect people from dehydration, improve the function of the gut, really help, again, just the overall body feel better. And so dehydration is I've seen so much dehydration this summer, but even in the winter, people can easily become dehydrated. So that can make a difference in terms of retaining good levels of hydration. And then we have digestive enzymes. So a lot of people especially if their stress level is very high, or maybe it's aggravated at the time for whatever reason, we use pancreatic enzymes and we use advanced digestive enzymes to actually ease the digestive process. So this helps them break their food down so that they can absorb the nutrients, and it can really decrease on bloating and just help digestion work better, less symptomatic. Typically, we recommend taking that. So you would start eating a meal and then you take the digestive enzyme and then you would finish the meal. You don't really want to take that like an hour after eating because you want food in the stomach for that digestive enzyme to work on. The advanced digestive enzymes work for carbohydrates, fat, and protein, where the pancreatic enzymes are more specifically geared towards helping someone break down fat and protein. And then having some kind of a fish oil and anti-inflammatory support. So when you think of like all of the additives that are in our food, it can make our food very heavy in omega-6 fatty acids. And when we have an imbalance between omega-6 fatty acids and omega-3 fatty acids, we can definitely have more inflammation within our body. So we want to curb that inflammation by adding in some extra EPA DHA support, which is heavy omega-3s. We want a really clean, pure source. I use Metagenics because they're third-party tested by 3 different companies before they go on the shelf. So I really trust them in terms of their processing, but we want to really just help the body clear inflammation and have more balance to the system. And then we use orthomolecular D3K2 for many people because a lot of us are deficient in D3, and D3 is one of the biggest protectors of the body from cancer. It also helps with our being able to absorb calcium and utilize calcium to build strong bones. I mean, we could go into a whole nother topic there, but osteoporosis is even a disease that is typically related to poor gut health because typically someone may be taking calcium, they may be exercising, but if their gut isn't absorbing the nutrients that it needs to build strong bones, that's usually at the root of the issue. There's also an inflammatory component of that, usually a lot of gut inflammation with osteoporosis. It's not how our medical system typically looks at things. So you could add a drug in to try to build extra bone, but typically that extra bone that's built is not healthy, strong bone. So again, if we want to get to the root of the issue, we want to look at the stress response. We want to look at the D3K2 in terms of how do we help the body actually build extra bone, and then get to the gut issue as well, and really start to heal leaky gut. So I've given you a lot and I hope it's helpful, but really in summary, we want to work towards healing that stress response. I want you to create new patternings and really how you're living. I'm asking you, which I know is a lot, I'm asking you to create new habits, new routines that are helping to remind you to breathe, to get out in nature, to get maybe sunshine, to breathe fresh air, to handle your stress in a different way, have different strategies for that. Your adjustments and the consistency of things and how you're going about that process, like your consistency of your adjustments is huge in terms of creating resiliency, in terms of regulating how the nervous system is functioning and increasing that parasympathetic stress response, increasing that piece of it so we can decrease the fight or flight stress response, healing the subluxations that are affecting the communication between the brain and the rest of the body. But all of that, I want you to have those actionable stress management strategies that are starting to be built into your routine. IgG testing, or if necessary, or you go about the process of trying to determine what your IgG allergies are if you really feel that leaky gut is something that's affecting you and affecting your life. We want to make dietary changes, and we want to figure out what the supplements are to support that healing process of the intestinal lining, and ask us for that support. I mean, we are here to help you, and every person is different. I did not give you that whole list of supplements saying that everybody should be on all of these things. We tailor that to each individual, but we want to make sure that we have consistent support so that not only is your diet changing, but you also have the correct nutrients in terms of creating a healing response. And then you're putting in the consistent time and effort so that you notice changes along the way is really key. So just so you know, all of our gut health supplements are currently 20% off. You want to make sure, if you want more information about what we talked about tonight, our current blog that's on on bodyimbalancechiropractic.com/blog is on the nervous system, the GI tract, and autoimmune conditions, and the connection between all of that. And then we always ask you to share Network Chiropractic because it's an act of kindness, especially to those who want a gentle approach to their healing and they want to get to the root of health issues. So we always need your help to help others. Upcoming classes. So speaking of breath work, so on September 9th, we're going to have an introduction to somatorespiratory integration, all about breath work, all about tapping into how do we feel where maybe things are stuck within our body, where the breath isn't moving, how to create more flow, how do we create more of that parasympathetic state that we can use all throughout our day. So it will teach you different strategies that you can use, breath and even specific movements to go along with that breath to activate parasympathetic, as well as positive declarations. So I love that. And then I just wanted to let you know too, on September 30th, we're having an event actually in the office. It's not a Zoom class. It's a women's well-being event. And this is near and dear to my heart because we're really going to talk about what it would look like to become your most healthy, most vibrant self, and really to be able to let go of baggage. And so if you were able to heal the energetic attachment to that baggage, what would it look like? What would your sense of well-being like? Would you be more resilient? So bring your mom, bring your best friend, a coworker. We'll have a special gift for all of our attendees, but make sure that you RSVP because that class will most likely fill up pretty quickly. So I thank you so much for your time. I'm going to go over to the Q&A. So if you have a question or have any information that we need to make sure that we talk about, please make sure you type that into the Q&A box. And I will see if there's any kind of questions that people have. I'm going to hang out here. See here. Okay. You saw the electrolyte mix at the office. Yes, we do. We have the electrolyte office or the electrolyte mix at the office. It's and our staff will know it because I take it often myself and I'm always make sure that it's here, but it's the dynamic, and now I'm like blanking on the name, but I told you guys what it is, but it's in a black container, but yes, it's always at the office. So yes. Any other questions? Okay. Okay, so the app for meditation, my favorite one is called Insight Timer. So it's the word insight, INSIGHT timer. And there's guided meditations on it that I use all the time. I have a mountain meditation that's my favorite. And I've used that one for years, but then I switch all over the place depending on my mood or if there's like a topic I really want to work on. So that is, there's tons of stuff that you can do with that. So I hope you enjoy, but please ask me if you need any help with it. Yes. Okay. And so the class tonight is definitely recorded. You will get a copy of it. So Zoom will actually email the copy of this for you tomorrow, but I believe that only is good for like a couple of days. Dr. Scott will get this onto our YouTube channel. And so we'll be able to share the link with you, or you'll be able to look under our Body and Balance Wellness Center YouTube page or YouTube site, whatever that is. You can tell that kind of stuff is not my strength. But it'll be on that as well. So you can always get, if you have other people that you need to share this with, you can get that to them. Okay. Any other questions that I can answer, guys? Okay, well, I thank you all so much for being here tonight. Please know that Dr. Scott and I are available. So if you have questions, there's anything you need extra information on, if you need recommendations for specific supplements for yourself, if you need information about care, whatever it is, please ask us. We always want to be a resource for you. But I so appreciate your time. As you can tell, I'm super passionate about this information. And so I love that we had such a great group here tonight. But again, if you need anything else and about this topic at all, please feel free to reach out. I hope you have a great evening and I'll hope to see you soon. Thank you guys and good night.